Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. And I've seen many media reports telling the public that the use of a multiple vitamin and mineral supplement each day has not been shown to provide any significant health benefits. I don't know why these reports keep surfacing, as we've seen in recent years that several large human studies, including randomized placebo-controlled studies, have shown very impressive health benefits in people taking a daily multiple vitamin. For instance, the Physicians Health Study 2 and the U.S. Preventive Services Task Force 2022 review reported that invasive cancer was reduced with multiple vitamin supplementation. In other words, in two very large studies, a review of large populations being followed over a long period of time, people taking a multiple vitamin each day are showing less invasive cancer. That's pretty significant. We also saw a reduced risk of developing cataracts in the Physicians Health Study 2 in subjects taking a daily multiple vitamin, and the Cosmos study showed that daily use of a multivitamin significantly slowed age-related memory loss. Very significant. Now, in 2025, a study was presented at the American Heart Association conference that showed that multiple vitamin use slowed biological aging in a randomized human clinical trial. Now, biological aging can be measured by looking at epigenetic changes to our DNA, mainly these patterns of what are called methylation. The study involved approximately 950 men and women over the age of 60 who had baseline blood levels done, and then they were followed for 2 years afterwards. Half the group got a multiple vitamin, the other group got a placebo. The group given the daily multiple vitamin showed a 10 to 20% slowing of the body's epigenetic clock compared to the placebo group. Because age-related changes in our DNA also encourage the development of various degenerative diseases, anything that slows biological aging at the cellular DNA level also tends to decrease the risk of developing various age-related diseases. This report is truly eye-opening, prompting researchers to state that authorities should begin to consider disease prevention guidelines that include the use of a multivitamin, in addition to current recommendations around diet and exercise, of course. Now, in my view, a multivitamin that you take should be enriched with higher levels of antioxidants. Like it should have 1,000 milligrams of vitamin C, 400 IUs of vitamin E, 200 micrograms of selenium. You need boosted levels of antioxidants like this, as well as containing a B50 complex. That means about 50 milligrams of most B vitamins. It should have 500 milligrams of elemental calcium and 1,000 IUs of vitamin D, along with some lycopene and lutein to protect your eyes, prostate gland, cervix, and some breast tissue. That's what a high-potency all-in-one multivitamin should look like, in my view, to get maximum health benefits. So I've included a link to the Medscape article, which reviews the studies showing the health benefits of multivitamins in human studies. So thanks for watching, and I'll see you next time.